All right, well, welcome everyone. We are here tonight for the Mass Call 3 Youth Substance Misuse Community Needs Assessment. We've had a lot of folks working on this from Somerville, Everett, Arlington, and Lexington. We are proud of the work we've done over the last year to collect all of this information. And this is an opportunity to share it with folks, the first opportunity, I should say, to share it with folks as we start looking towards strategic planning and stuff for our next steps. So we'll do a round of introductions of everybody who was involved in it shortly, but we want to go right into kind of what we're going to be covering today and what we're going to be talking about. And I would be remiss if we didn't thank our friends from Institute for Community Health, ICH, for helping us put this together tonight. So the first thing, just to talk a little bit, we're going to talk about Mass Call 3, what it is and kind of the work that we're looking to do, aiming to do, and the goals of the grant. We're going to talk about our overall needs assessment findings, talk about some recommendations that we were gathering from community members, and then we're going to have discussion opportunities. There's going to be at least 3 during the presentation, so we'll do breakout rooms to break up the presentation, and then we'll have one larger share back at the end with some other questions and intentional questions for people to comment on. So what is Mass Call 3? So it stands for the Massachusetts Collaborative for Action, Leadership, and Learning, number 3. There's been multiple versions of this in the past. It's a grant that is led by the Department of Public Health's Bureau of Substance Addiction Services, BSAS, that supports substance use prevention, particularly for youth, initiatives in cities and towns across the state. So this program is exclusively or explicitly focused on addressing racial equity in prevention program, and you're going to see that throughout the presentation today. As part of the Mass Call 3 work, our cities and towns work together to design and implement prevention programming. This cluster is made up of the city of Somerville, Cambridge Health Alliance Everett, the town of Arlington, and the town of Lexington. You may hear us refer to us as S.E.A.L for the purposes of just keeping it easy and a nice acronym. And ICH was actually a partner that we brought on to collaborate with, particularly on supporting our needs assessment efforts and evaluating the program as the cluster moves forward and decides kind of what strategies we're going to be implementing. So here's the main group of folks. You get to see all of our faces. So again, I'm Matt Mitchell. I am the Prevention Services Manager with the City of Somerville.
Hi, everyone. I'm Lily Joliak. I am the Substance Misuse Prevention Coordinator for the City of Somerville.
Hi, everyone. My name is Lovely Heller-Botari. I'm the Program Director with Somerville Cares About Prevention in the City of Somerville. And also, I want to give a shout out to our SPF 100 and SPF Junior leaders here tonight who are also part of Mass Call 3.
Good evening. I'm Jamie Lederer. Thanks everyone for joining us. I work at the Cambridge Health Alliance in our community health department and oversee our youth initiatives, and we're involved with this work in the city of Everett.
Hello, everyone. I'm Marie-Eveline Antoine. I am the youth coordinator with Cambridge Health Alliance, and I'm focusing on Everett as well.
Hi, everyone. My name is Colleen Legere, and I'm the director of the Arlington Youth Counseling Center, and I'm here representing Arlington in this initiative tonight.
Hi, everyone. My name is Sharon Gunda. I'm the Clinical and Community Outreach Manager for the Lexington Human Services Department.
All right, so that's us. And without further ado, we're going to turn it over to our friends at ICH.
Thank you, Matt. And thanks everybody for joining us today. We're really excited to present back on some of what we've been working on with the S.E.A.L cluster. But first, I'll just briefly introduce myself. My name is Julia Gurbera. I'm a research and evaluation project manager at the Institute for Community Health and have been working with the S.E.A.L cluster on the needs assessment so far. And I'm also joined here tonight by my colleague, Jeff Demaray, who I'll let introduce himself as well.
Jeff Demaray, work with Julia and all these fine folks in the S.E.A.L cluster, and I'm a research and evaluation scientist at the Institute for Community Health.
Great. And I'll give a shout out to our other members of the evaluation team who haven't been able to be here today, Roxanne James and Erin McPherson. So great. Yeah. ICH has been helping, like I said, with conducting a needs assessment around substance misuse prevention needs, focusing on youth for the MassCall 3 grant. And a needs assessment is pretty much just a process of gathering data from sources like surveys, interviews, community conversations, just to help us get an idea of what needs and resources exist in the community around substance misuse and what we might need to know to inform programming. Next slide. And so we've been engaging in this needs assessment since the spring, and we've undertaken a few activities to gather this kind of data. And I should give a huge shout out to the S.E.A.L cluster folks who were primarily involved in gathering and analyzing and putting together a lot of this data. So they conducted 21 interviews with key stakeholders working in the community. So these are folks who might work in schools, public safety, at youth serving programs, and who have knowledge and experience with prevention work. Some of you who may have participated might be in the room. You can go to the next. And we also talked about, we also talked with caregivers in all of the communities in 6 different focus groups with 38 people total. And these focus groups were done in English, Spanish, and Portuguese. And then finally, we talked to 75 youth across the communities in 8 different focus groups to get their feedback and thoughts on prevention programming. And we were also pretty interested. We also were committed to making sure we reached a diverse group of people in the needs assessment. So we collected demographic surveys. If you want to go to the next slide, Matt. So there was 134 participants total in the needs assessment from our interviews and focus groups, and we collected 80 surveys with just general demographic questions, again, to ensure we are reaching a diverse group. And so the 80 that we spoke to, or we gave surveys to, we received race and ethnicity information. Around 37% of the participants identified as white, 27% as Black or African American, and then some smaller percentages of Hispanic or Latinx or Asian identities as well. And then in terms of gender, we reached around 60% of our participants who responded to the survey were identifying as female, 37% as male, and 4% as gender variant and non-conforming. And so we talked to a whole bunch of folks, and we also looked at a lot of existing data that we have on student health from student health surveys. Each town, Somerville, Everett, Arlington, and Lexington all collect these surveys. And so we reviewed some of the substance misuse related indicators from those, and we also consulted state level data on substance misuse. And so some of the indicators we wanted to look at as part of the needs assessment were current use or 30-day use of alcohol, marijuana, and electronic vapor products. These were identified as some of the more common products or substances that youth were using. So we were sort of focusing on those. We wanted to know about what age around what age youth were starting to use substances, any changes over time in substance misuse, including impact of the pandemic, and also looking at depression and stress among youth as some of the potential causes of substance misuse. And so we also were, really wanted to see if groups were, different race, ethnic, gender, or sexual orientation groups were using substances differently or having different experiences with substance misuse. So we looked at these indicators for youth overall, but also by these different groups as well. Go to the next slide. Great. And so those were the activities that we underwent in the needs assessment. And to make a quick note before we start diving into data, we reviewed all of the data that we had at the cluster level. So we wanted to see themes or trends that came up across all the towns. So as we start discussing the data, you'll notice that we will refer to what we found at the S.E.A.L cluster level, or also comparing it to the state level as well. Great. And so some of the first set of data that we'll talk about today is what we found just in terms of, overall substance misuse trends among youth in the cluster and in Massachusetts over time. And if we start sort of zooming out, in Massachusetts, we actually can see that use of marijuana, one of the substances that we are interested in, and binge drinking as well, for 12 to 17-year-olds has either decreased or stayed constant from 2002 to 2019 in Massachusetts. And we can kind of see these trends emerge from these graphs below. And then zooming in a little bit more and looking at some of the current use trends, the 30-day use of these different substances among youth in the S.E.A.L cluster, we see that overall youth in S.E.A.L are reporting lower rates than Massachusetts, than Student Health Survey data in Massachusetts for all three of the substances of interest. And then among these three substances, alcohol use was most frequently reported as current day use. Great. So we also wanted to understand a little bit about at what age were youth starting to use substances. And the sort of benchmark indicator for this was youth who are using substances before 13 as sort of a primary risk factor for later substance misuse. And so when we look at this indicator and compare the S.E.A.L cluster to the state, we see that fewer S.E.A.L students reporting trying alcohol or marijuana before age 13 than the ones surveyed in the overall Massachusetts survey. And you can see, just as an example in this graph, that in the Massachusetts or statewide survey done with this question included, 12% of that sample indicated that they had used or if high schoolers had used alcohol before age 13, and then the percentages across the S.E.A.L cluster were lower than that. And then we could also see from this data that 15 to 16 years was the most common age of first use for the people who were reporting substance use at all. And I think a key takeaway I'll add here as well is that the majority of S.E.A.L Student Health Survey respondents were reporting that they had never tried either of these substances, but these were the most common ages that people who had tried them were trying them. Great. And so for, looking at substance misuse trends, we also wanted to get community feedback about what people were seeing on the ground or experiencing. And so one thing that came up when we talked to caregivers was that folks felt that youth substance misuse had gotten worse over time. And so that was a perception that came up then. And then we also sort of consulted the youth perspective on how they felt substance use was changing over time, and some did agreed that substance misuse had increased during the pandemic. And others had a different opinion and mentioned that substance misuse has decreased, and mentioned that there were other youth programs and supports available that were contributing to that. And then finally, a really frequent topic of discussion in our interviews and focus groups were that vape products were probably the most common substance among youth as well. Great, go to the next slide. All right, so that is the sort of first set of data that we shared, broadly summarizing some trends over time and how different folks in the community are observing that as well. So I think this is when we are going to break out into our first discussion groups to reflect on some of these questions. If there's anything surprising to you about some of the data that was presented, and if you feel like there's anything missing from the data that we should know about in the assessment.
Yes, so thank you, Julia, for that. So we're going to be breaking us up into about 9 different rooms. So there'll be about 7 to 8 different participants in the room. There's going to be a representative from S.E.A.L or ICH in each of the rooms that will have the questions. And you're going to stay in the rooms for about 8 minutes. So just be mindful of how much you're sharing to give everybody an opportunity to participate. So I'm going to start breaking it up into rooms now. So just give me 1 second and we will get into the groups.
While Matt sets up the breakout groups, I want to put a quick plug into the chat right now. We have a Jamboard set up that folks can refer to during our discussions, and just leave any additional thoughts or comments that you'd like to share in a different format here as well. And the facilitators will share this again in the breakout rooms if needed.
All right, 1 second. Just need to get one more person into a room that I was looking for.
There's also someone else just entered the meeting too, Matt.
Okay, I can assign them after we kind of break it up. All right, so I think I have everybody in a group. So we're gonna break up.
Excuse me, Matthew, I'm not in a group. I don't
Oh, we
see it.
haven't opened the rooms yet.
Oh, sorry.
No worries. So I'm just gonna open up the rooms now.
Hey, Matt.
Hello.
Oh, I see that there's a group I can join.
Yep.
I'm late, so I missed the data presentation.
No worries. We're actually doing, we're breaking it up. So there's more to it. This is just the first third.
Okay.
Nice to see you.
Well, actually, you're not going to see me, but it's nice to see you.
No worries.
It's been a while.
It
Yeah.
has.
Yeah, we'll talk soon. Okay.
Sounds good.
Bye.
Bye.
Hey, Matt, the Jamboard didn't work.
Oh,
It was in view only.
oh, okay. I'll let Julia know. Thank you. We're saving that mostly for the end anyways. Julia, just an FYI, the Jamboard needs to change from view only to
Oh, thanks. Perfect.
all right. Well, welcome back, everyone. We'll be breaking up again, but we're going to go into the next section now.
Great. Yeah, thanks everyone. I hope that you're able to get some conversation started and reflection started. Definitely keep putting some thoughts in the Jamboard now that it's accessible, and the chat as well. So great, we'll continue. So we just shared a little bit about some of the overall trends in youth substance misuse that we've been seeing in the cluster and across Massachusetts. And another question that we wanted to hear a little bit about in our needs assessment was, what are some of the causes of youth substance misuse? And to this, we mostly looked to our community feedback from interviews and focus groups. And one theme that came up quite often across all of the focus groups and interviews was that youth often use substances to cope with stress and mental health challenges. But we also heard a lot about other potential drivers or causes of substance misuse from people's experiences or things that they've been observing, such as peer and social pressure, influences from people's friends or youth's social groups. Folks discussed barriers to substance misuse and mental health services that might exacerbate substance misuse. Caregivers also talked about a lack of supervision and childcare access, leaving caregivers who are busy balancing different responsibilities without supervision for their youth. Caregivers also discussed legalization of marijuana that might be facilitating youth access. And key stakeholders did acknowledge that systemic racism and poverty are some factors that are driving substance misuse, particularly among BIPOC and low-income youth. And we'll get into this in a little bit more detail later on in the presentation. And so since this emphasis on mental health as driving substance misuse came up in our community feedback, we looked at some data from student health surveys on experiences of depression among youth. And so when we look at data on depression from student health surveys, we use a pretty uniform indicator that if you click to the next slide, Matt, depression as an experience of feeling so sad or hopeless for 2 weeks or more that youth who might be responding to this question stop doing some usual activities. And so when asked this question, this is a question that's asked across the country and also in our student health surveys as well. United States-wide data does show that depression among youth is increasing. And in Massachusetts and the S.E.A.L cluster, we do see that between 20% and 40% of student health survey respondents reported experiencing depression. I want to click to the graph. Yeah, and this is drawn from data from middle school when available, and as well as high school. And go to the next slide. And again, since we had a focus in our community feedback on stress being a cause of substance misuse, we looked at student health survey data on higher ranked sources of stress for students, and school demands and expectations. Also having a busy activity schedule were top sources of stress across the towns for middle schoolers and high schoolers. And then for high school students in particular, also noted stress from worrying about the future, such as things like college, appearance, and family issues. And so we'll take another short break right now to have a conversation about, or a reflection about things that were surprising or things that were missing from the data that you think that we should know about related to causes of youth substance misuse.
All right, so we're going to have another 8 minutes for folks to get back in groups. and it'll go a little bit smoother now since we've got them all organized. So it will be going back into the same groups that you were in before. So should be opening now.
Matt, my invitation vanished, but I know I'm in breakout room 9.
Oh, all right. I'll assign you back. I'm going to move you to 8, but then move you back to 9.
Matt,
Yes.
can you join Marie's group? Some questions that she could use some help with.
Marie, which group is that?
Marie Eveline,
Oh, gotcha.
thank you.
Yep.
Able to click on it or write on it.
Sorry, was there any questions? I think I heard there were some questions.
I had a
asked
question. Go ahead.
Go ahead. I'm so sorry.
I had a question on the, are the 2 questions that we used earlier related to this second part of the presentation?
Mhm.
Okay, around the family issues, depression, things like that. Okay. And the Jamboard,
Yeah, the Jamboard's more. The Jamboard's going to be used more towards the end.
Okay.
So we'll explain that in the big, great crowd, the group discussion.
okay.
Sarah, did you have a question?
Yes, I'll try to repeat the question that I asked in the earlier group, which was how was the youth in the focus group selected? Were they self-selected? Were they a random sample? Were they people who happened to be in a particular place on a particular day? And were the evaluations that for the demographics, including things like housing instability, families in which there was substance abuse, the kinds of questions that might lead one to find out how representative of all the youth in these communities are these 130 or 150 students?
So it was a combination. Some self-selected where we put it out to people to participate, where they got compensated for their participation. Others were youth groups that we knew already existed that were fairly representative of different populations. So we went to I don't want to specifically say the youth groups, but I don't want to identify anybody, but there were youth groups at the high school, youth groups that are in the community, and youth groups that work with nonprofit agencies. And so it was a combination of self-select, but also of existing groups of people that we already know that are doing work in either substance use or just in general doing like advocacy or education type work. And I think there was a second part to your question, but I didn't catch all of it.
Did you have any information about breakdown as far as economic stability, housing instability, families in which there was alcohol or substance use?
we didn't ask specifically about some of those aspects, but we had a whole toolkit of questions that were asked, and they were questions that were tailored to the questions we talked about at the beginning of age of first use, causes or things that people feel like are contributing to substance misuse. We didn't really particularly look at like socioeconomic or anything or ask specifically about that. But yeah. We also looked at the qualitative and quantitative data. So we do student health surveys each year, and the student health survey that we do has more of the quantitative data that is across each of the 4 cities. And then the qualitative was more the focus groups and the stakeholder interviews.
I asked because I was surprised that the rates were so low.
Yeah, I mean, it is the data is the data, I guess, when it comes to that. I think it was fairly representative of many different folks. I mean, we also did a lot of outreach to Spanish and Portuguese speaking agencies in our towns. So I think, I can't explain why it's so low, but I think there's different things that can contribute to that. Yeah. Any other questions?
So my question is, how would this data, it's like posts, I guess. How would this data bring the community and the youth into the substance abuse prevention into a solution?
So after we present this is like the first phase of presenting the data.
Okay.
And so we're presenting it to as many people who would come tonight. And then the intention is to go back to the groups that we had worked with, as well as additional groups that we weren't able to reach, to present the findings and basically have the same type of discussion of like, did this surprise you that, the rates were lower? Or do you feel like we need to reach out to a certain group of people that we haven't captured in this? So this is like the first phase of the share back so that we can get a sense of what we have so far and then take it from there to strategically plan.
Oh, okay, that's great. Awesome.
Okay.
Well, I can ask one more question if
Go for
there's
it.
time.
Yeah.
The cities involved, the 4 cities have very different kind of demographic populations in them. And so were the people in the focus groups evenly balanced between the 4 cities? The 4 communities?
Yeah, I would say they were representative of each of their communities. So while there may be a larger subset of people that are in Everett or Somerville, I think each city had its own different representation. So I think part of the reason why we partnered as a region was that we actually are so different, but we're also trying to say that substance use prevention is something that we can kind of cut across each of the 4. So we can tailor our strategies to each community, but also all of us working on the same strategy. So yeah, like for example, Somerville, we had much more of a Hispanic and white population that were involved, where in Lexington, it was more of an Asian and white population that was involved. And that was representative of their demographics for a city or a town overall. Sorry, I'm just checking the time to make sure I give people notice to go back to the main room. So I'm going to jump back and we can talk more after. Welcome back, everyone. We'll move into our next phase once everybody gets back from the breakout rooms. All right, Julia, back to you.
Great. Well, great. I hope that everyone was able to continue their discussion on causes of youth substance misuse. And I'm actually going to turn it over to my colleague Jeff, who's going to keep presenting on some additional pieces of data. Matt, would you like us to, or should we pull up slides? Oh, okay.
1 second. There you go.
Great.
Awesome. Great. So just to kind of recap, so we just kind of talked about some overall trends, right? So the trend means something that's changing over time, right? Or some differences across kind of groups at a big level. And then also what is driving or what's causing or what's motivating youth substance misuse. Now we wanted to kind of focus on whether or not some groups are using substances differently than one another. And we're going to look at that in a couple different ways. We're going to look at it by race, ethnicity. We're going to look at it by gender, and we're going to look at it by sexual orientation. And so it's just basically important to understand these differences so different groups can receive services and supports based upon their on potentially different needs. So to start the conversation, we're first going to focus on race, and we wanted to kind of give a breakdown of different race and ethnic groups in each of the S.E.A.L towns, because these communities are fairly different from one another. So overall, this is the demographics for public school or for students enrolled in public school districts in each of these towns. So that's where this information comes from. So if you look at the kind of donut on the left, Somerville. So Somerville is mostly white and Hispanic, with smaller shares of African American and Asian students. Everett is more than 60% Hispanic, with lower percentages of white and African American students. Arlington is nearly 70% white, and Lexington is mostly made up of Asian and white young people, with lower percentages from the other racial ethnic groups. And so just keep this in mind when we're presenting some of these trends by race, since some of these different numbers of students from each group in each town are very small and you can't always necessarily compare them. All right, so we look at current use by race ethnicity. You click, yeah. What we see is that white, Black, and Hispanic, or Latino, Latinx, young people in S.E.A.L and Massachusetts reported the highest rates of current use. So again, current use is like in the last 30 days for marijuana, alcohol, and electronic vapor products. And we do see some variation by town and by substance. But these are kind of the fairly general kind of trends. If we look at age of first use, we do see that Black and Hispanic youth reported higher rates of using alcohol before age 13 across Massachusetts. And this is also a pattern in some of the cluster student health surveys. But again, for some of these groups, the numbers aren't very high, so we need to kind of be a little cautious with this interpretation. And we'll also see that Black and Hispanic Latinx students also reported the highest rates of depression in S.E.A.L student health surveys. And then what's also consistent is that young people who identify as Asian, including those who identifying as South Asian in Lexington, reported the lowest rates of current use and of alcohol use before age 13. So that was again from the survey data. This next information is from the community feedback, so the focus groups, the interviews. So what we found is that most people didn't think there were actually differences across racial ethnic lines. Most people thought that people were using drugs in similar ways. And of those that did think that there were some differences, some mentioned that BIPOC youth in general used at higher rates due to stress, mental health challenges, and bullying, but they didn't really differentiate between within BIPOC youth, right? They just kind of spoke more generally. So it's one kind of caveat there. Other stakeholders kind of disagree with that, and they saw that white, socially white and socioeconomically privileged youth use substances more. they kind of attributed that to them basically not being able to have more resources to access those drugs, and having less strong consequences, being less likely to be punished by authority figures. And then a few mentioned that, families or cultural factors might limit some groups' adult substance use and misuse, which could then make not using substances more kind of normalized, and that could then maybe impact, which young people are engaging in drug use. All right. So now looking at by gender. So for this next kind of group we have here is again all of the different school districts, and just the enrollment and the gender identity of those that are enrolled in school. And so here we see that in Somerville, 52% identify as female, whereas 48% identified as male, and 0.2% identify as non-binary. In Everett, we have nearly half identify as male, half identify as female. Arlington, again, nearly half identify as male, half identify as female, with very 0.4% identifying as non-binary, and then same thing for Lexington. When we look at our data from the student health surveys, we see that female and genderqueer youth overall reported higher rates of current use for alcohol, marijuana, and vape products. They also generally reported higher rates of first use before the age 13 in the of alcohol in the S.E.A.L cluster. And so one thing to note is that females and genderqueer youth reported depression more frequently than males in the student health surveys. So this is what that information shows right there. And so a large portion, we definitely want to note that a large portion of females reported depression across the towns. So if you look at this chart here, you'll see that the percentages for each of these categories followed by the total number of individuals in each group in the survey. So if you look at Somerville on the left-hand side, 42% out of 282 females reported depression. There were also higher percentages of genderqueer students who reported depression. This was also out of a smaller group. So look at Arlington, for example, 82% of genderqueer youth reported experiencing depression, and this was out of 52 that identified as genderqueer and answered the survey. So basically, the kind of big trends is that females and genderqueer youth definitely reported kind of higher levels of depression than male youth, and this was also kind of reflected in the community interviews that we did. All right, and finally, we're going to look at some of the limited data that we have on substance misuse by sexual orientation. In Massachusetts and Lexington, those are the two communities where we could get, those are the two surveys we could get information from the surveys. And so while there were fewer LGBTQ students in both surveys, a greater proportion of these students reported that they used alcohol, marijuana, and vape products in the last 30 days compared to non-LGBTQ plus students. And this was a similar pattern for youth using alcohol before age 13, as well as for depression. And this is a chart that kind of provides an overview here. Right, so thanks. Okay, and then finally, another kind of thing we were looking at was substance misuse by socioeconomic status. What do we mean by that? Just by the income, could be occupation of the family, could be wealth. And so what we found was that, and so this information was only available in the community interviews and focus groups that we did, and we couldn't get this information from the student health surveys. So some key stakeholders and caregivers mentioned that low-income youth may misuse substances at higher rates, while others mentioned higher income and more privileged youth using more due to resources and access. So one kind of takeaway here is that there was some disagreement around whether or not certain groups of lower income or higher income are using more. And And something that they did note, though, more kind of consistently, is that income and socioeconomic status can impact how families are able to access treatment and services if the young people in their lives are in need of treatment or mental health services. And caregivers in particular mentioned that it's more difficult for low-income families to get to access out-of-school programming and overall activities for youth. Great. So similarly, we're going to break out into discussions. I know you covered a lot of information there, and have another 8-minute chat and then get back for the rest of it.
Thank you, Jeff. I'll break up people into rooms shortly. Just give me 1 second. All right, opening the rooms now. Welcome everyone back as we're getting to the final stretch of the presentation before we do our larger breakout discussions. So once everyone's back, it looks like they're slowly making their way back. Julia or Jeff, you can take it away.
All right, we are back. Thanks everybody for in my group for sharing this very interesting conversation that we've been having. All right, so this last part of our presentation is going to focus on a few questions we asked youth caregivers and stakeholders during our interviews and focus groups. And we're going to start with wanting to know what the impacts of substance misuse they've seen and are concerned about. So we kind of, believe that substance use among young people is an issue, but why, right? And this is kind of what this is. People that we spoke with, this is their why. So for the young people we spoke with in the focus groups, they shared that there are social, emotional, academic, and health consequences of youth substance misuse. So socially, they can maybe get into more fights, or maybe they can become alienated from certain social groups if they engage in drug use or don't engage in drug use. They could have emotional issues if they're using substances, like in other words, conflict or from the substances themselves. They might have academic performance issues, whether it's from suspension or from just the impact of substances on kind of their mind, and could also have health consequences because there are some negative health consequences of using drugs. They also noted that vaping of nicotine and marijuana, particularly in bathrooms, have negative impacts on school environment. So some people saying they'll try to avoid certain bathrooms and have to walk to a bathroom kind of far away. Don't want to go in there, they want to be around it and not feeling kind of good in that school environment. And then they also said that one of the impacts for substance misuse is that there can be punitive responses. So like people can get suspended if they're vaping in school or have some drugs on them in school. And they then kind of in reaction to that started talking about calling for wanting to have more supportive responses to use substance misuse, like counseling or support, rather than more punitive responses. Because that can oftentimes make the issues worse. So we also want to know about the different experiences in substance misuse impacts across groups. So when asked about this, some key stakeholders mentioned that youth of color and low-income youth might receive stronger consequences for substance misuse, and that youth who are more privileged or have higher social standing, like maybe athletes, they may not have as many consequences because maybe they're more connected, right? If they're a star athlete, maybe they kind of have connections, and they'll be more likely to make it slide for them. And then also kind of calling back to something we mentioned earlier, socioeconomic factors like income and job and employment all impact people's ability and families' ability to obtain resources and support members of their family if they are experiencing issues with substance use. And kind of across the board, there's a call for really needing more supportive resources for all youth. We also asked about what resources currently exist and what thoughts they have on those existing programs. So they definitely noted there's a need for more free or affordable out-of-school opportunities for youth, particularly for low-income families. And the youth mentioned that they're, in the focus groups mentioned they're unaware of existing resources to prevent substance misuse, but are interested and willing to engage in these resources. They just didn't know about them. And they also were talking about a lot of different barriers. So what prevents them or makes it harder to access these services around substance misuse treatment and mental health support for youth. And in particular, they kind of called out not having enough clinicians or providers to meet the needs of the youth. So there's too many there's not enough clinicians and there's too kind of high demand, that the costs of services, whether it's a copay or if insurance doesn't cover a service at all, right, is too high. And there's also some issues with getting there, right? So even if the service exists, can you get there? Do you have transportation there? And then there are also linguistic and cultural barriers, such as not all services are offered in the languages that the young people or their families feel the most comfortable in. And they're also not delivered necessarily in a way that kind of reflects their culture and their values. And so these issues in particular that we just kind of covered, these barriers, were even more kind of compounded, even more kind of heightened for marginalized groups. And then we also wanted to know, finally, before we get into recommendations, where they get trusted information from around substance misuse. And so one of the sources is that you've turned to parents, teachers, counselors, and other trusted adults to kind of learn more about it or get their advice on it. And more than half of the youth in the S.E.A.L student health surveys reported having a trusted adult at school and parent or other family adult to talk to a problem about. And then youth prefer multiple sources of information on youth substance misuse, including information online and on social media, so they can kind of go out and look up information for themselves. So really trying to have adults support them and trusted parents support them with information, but also having information they can find on their own. All right, and so then what did they say needs to change? So what do they think kind of across the board needs to be different? So the first is that there needs to be more safe spaces and positive out-of-school programming that is free and flexible. They also called for more supportive and restorative approaches to youth substance misuse over more punitive measures. They want community information and education around substance misuse prevention for youth and caregivers. And they want all of this to be more fun, be less dry, and more engaging, because this stuff doesn't have to be dry. They also want programs to address cultural, economic, linguistic barriers to mental health and substance misuse treatment services. And finally, create more consistency in policies around youth substance misuse treatment and just in general across cities and towns, because there could be a lot of variation town by town. And then finally, I do want to note some limitations on kind of this needs assessment. It's important to note these. So some of our data is old. Some of the survey data was from 2019, which was pre-pandemic data. So just pandemic obviously had a huge impact on a lot of things. So it's one kind of limit for some of our data. We also had limited time to conduct interviews and focus groups. We'd have loved to conduct more focus groups and interviews, but we were able to get as much done as we could. And we also would have liked to pull in additional data sources. We were able to pull in what we were able to, given our time and capacity. And then particularly when we're asking about disparities, specifically around like kind of racial disparities, focus groups and interviewees didn't always kind of provide specific information about are these disparities or barriers or challenges for young people who identify as Black, identify as Hispanic Latinx, identify as like Southeast Asian, right? So that is one other kind of limit on some of this information.
All right, thank you, Jeff. And I want to thank both Julia and Jeff for the facilitation of some of or all of the data tonight. I know sometimes it could be hard and overwhelming to consume all of the data, so we tried to do our best to break it up. But we will certainly send out the recording and the slides to folks so they can look at it or refer to it after the presentation. So for us as a cluster, our next steps is to just finalize the assessment findings with additional community feedback. So this is the first phase of our share back, where we try to reach as many people as possible in the first meeting. And then we're going to go and start doing targeted outreach to some of the groups we convened or talked with in the process, and then also some of the groups that are not represented here tonight, so that we can take the findings to them and get a better sense from them, their experience with the data and some of the things that we were reporting. Once we feel like we have a good sense of everyone, or as many people as possible that we can, who can see this and get the information and give feedback, we're going to start having meetings, we'll gather the coalition of the cities together, have key stakeholders to start thinking about what our strategic plans are, because clearly there's a lot of information here and there's a lot of different things that we can focus on. And obviously we only have so much capacity. So we want to kind of focus on the things that we can really contribute to or, do within the scope of our work. So our hope is that we can continue to share back with folks and then strive towards finding strategic plans that meet the needs of the youth and the community in all of the communities. So to wrap up, we do have one final kind of group discussion. There's multiple ways that you can participate. You can just raise your hand or shout out. You can participate in the chat or you can participate in the Jamboard. So I know we can send the link again in the Jamboard, but basically how you use it is you just want to go to the left. I hope you can see it on my screen. And you want to go right here to where it says sticky note. Once you click on the sticky note, you can just type right into and then hit save and it'll pop up. Somebody on our end will kind of move it around. But as we go, we will change the board. So if you see up top, there's 5 slides here, but there's actually 4 questions. So the first question will be for this. And then when you click, you go over to the next one. So we're going to start with the first question.
Yeah, so we've thrown a lot of different data at you tonight. And what we would really like to hear from you all with going forward in our strategic planning, what are some things that you would all like for us to prioritize as we start to plan some of these programs for youth substance misuse? Feel free to shout it out, throw it in the chat.
I will say a quick one, which is language access. It is something that I heard from youth. It's something that when I spoke with the LGBTQ plus liaison for the city of Somerville, he couldn't mention numbers of folks from other ethnicities and races. So we started this discussion. Well, why aren't they present in group discussions? So this would be certainly one thing for me to point out as a priority for you, if possible. Thank you.
Thank you. Access.
And one thing I can just add to that is that this is an English version, obviously, but we have 2 other additional language specific opportunities. That's going to be the same presentation next Wednesday for Spanish speaking and next Thursday for Portuguese speaking. So we can certainly get that information to people if they don't have it already. Sorry, Lily.
No, that's fine. Thank you for sharing that. I see Kathy said access to prevention for all, as well as support for those who are already using. Prioritizing safe spaces for youth to talk with, no judgment. That's a good one. Yeah, family, parent, caregiver support education. That's a great place to plug. We have a Let's Talk workshop that we are rolling out, which talks about how to have more productive conversations as a caregiver to young people who are using substances. And we can connect more on that. Prioritizing programs that would support youth with their mental health and giving many resources. Having easier accessibility should be prioritized. Absolutely. Prioritize policy review for equity and substance use response in schools and communities. Community resources for prevention. Yeah, using social media to promote stress management strategies. Ask about use of available prescribed substances, home or purchased. What is being vaped? Definitely. Checking in hotline numbers.
All right, great. Those are some great suggestions. We definitely have people writing them down and making sure it gets to our notes. So appreciate all those responses. Next question.
The next question, what other recommendations do you have to strengthen youth substance misuse prevention programming in your community?
see a couple in the chat talking about community programming, high potency cannabis, for sure. Depression, able to access services, all great points. Sorry, Marie.
No, it's also resources at schools to meet them where they are at, so they do not have to transportation barriers. Science-based vaping and effects of it, yes, definitely. And NAMI, they have awesome supports from lived experiences, education and information about determining accuracy of information available on social media related to substance use and mental health. Inquiry about substance, S.E.A.L, ALC. Oh, going so fast. In families at risk, resources at school, libraries, playback theater, role play, and healing.
Got a flurry there.
Yeah.
All great resources. In the just the spirit of time, I think the last two questions that we have up here, go for it.
What was surprising to you about this information?
All of it was just totally exactly on point in your experiences, or they're things that you found a little surprising overall. Anyone want to put it in the chat? So I'm seeing in the chat, reported use, reported depression, reported higher reports of alcohol seems contradictory. Good to hear that youth are asking for support. Nothing too surprising, but surprised at the high number of substance use earlier in the presentation. Again, alcohol going down. Caregiver support. Talking about some of the missing data from LGBTQ+. Something it could, yeah, it's something we've been talking about for many years, decades, and still seeming to struggle with the increasing resources. Reported use seems low, and higher rate of female youth made think about outside factors to lead to that. All very good points. Last question. Take it away.
All right. Is there anything that you think is missing from our data that we should consider in the assessment?
So the ones I see just missing info might include what schools are doing around prevention and intervention partnerships that exist. Don't think anything was really missing. Great, we did an awesome job, everyone. Current years 2020 to present. Yep. Definitely COVID made that a little bit challenging for some who may not have been able to survey in the way that they were surveying in years past. Socioeconomic factors. Yep. Oh, I just got a flurry, so I missed a bunch.
Other illicit substances.
Yep. Go take it away.
No, it's okay. Go ahead. Continue.
Data, males reporting lower depression, more youth-focused thoughts on resources, definitely. Data sections, how youth is getting these, how youth are getting products, particularly if they're under 21. Youth perception of positive and negative consequences might help understand motivations. Good point. use of illicit substances. I assume that's, we're talking more like opioids and other drugs there. Yep. Oh, wonderful. So again, we're taking down all these notes. It's all just very helpful information that we're going to get. We're going to continue to compile and really just help us inform our next steps. So really, really appreciate everybody attending tonight. I think we got up to about 70 at one point. So always good to see such high participation rates. This is not the last end all be all. You know, this again is the first. So we do want to thank again, Julia, Jeff, Aaron, and Roxanne from ICH for their efforts tonight and just their efforts overall. And then we do have our contact information. So for whatever city you're coming from, these are your representatives in our cluster. So feel free to reach out, take a screenshot, do whatever you need to get the information. And we'll be in touch. If you have sent us your email in the chat, we'll add it to our distribution list so that we keep you updated and informed about some of the next steps. But we want to make sure that you have our contact information and you know the people who are doing the great work with you and on your behalf as well. So unless there's any other questions, I want to say thank you all for attending again. Thank you for all of the Somerville, Everett, Arlington, Lexington folks that helped put this together, ICH, and we'll continue. It is recording. The recording will be available. Once we wrap up here, I will make sure to get it out to folks. So again, reach out if you need anything, and we'll certainly be in touch. Take care.
All right, thank you.
Thank you.
Thank you. Thank you, everyone.
Thank you.
Good to see everyone.